Brown-Waite from Florida for purposes of an amendment.
There's an amendment at the desk, Mr. Chairman, and with your permission, I'll describe it as being passed out to save time. And I would move that the amendment be considered as read.
Without objection.
Thank you, sir. Obviously, my line of questioning on the COBRA issue is the theme of this amendment that we have before us. My amendment to the bill would require 3 studies to be conducted by the Government Accountability Office. The first study would report on increased costs, if any, to the employers as a result of the COBRA study that's authorized in this legislation. Specifically, the report seeks to determine whether the health care costs of COBRA eligible employees exceeds the amount of the premium subsidy received by the employee. COBRA tends to be the most expensive form of health coverage, and we want to ensure that neither employees nor employers endure greatly inflated costs due to the premium reduction in Title III. Regarding health information technology, the amendment calls for the GAO to study the impact of health information technology in the provisions in Title IV, specifically which healthcare providers purchase a health information technology, how much they spent, and the number of private sector jobs created as a result of this title. And finally, we're asking in this amendment the GAO to examine what effect comparable effectiveness research has had on coverage decisions and, comparative effectiveness research has had on coverage decisions, and if it's helped to streamline treatment and reduce health care costs. Mr. Chairman, it is in the committee's best interest to improve efficiency and transparency with regard to health care costs wherever possible, and that's exactly what this amendment does. It gives us the information and the tools that we need to know if we really are succeeding in this piece of legislation. Mr. Chairman, I see my time is up. I yield back.